Hello friends, I've been getting a lot of calls asking Dr. Roy, is COVID-19 back? So that's our topic for today. What is this JN1 variant? Do we have to worry about what's going on? What precautions can we take? That's the topic for today. The COVID-19 JN1 variant, a variant of interest, and how it is affecting us here in India. Friends, I'm Dr. Sitesh Roy, your allergist, immunologist and asthma specialist, coming to you with this special video. We have had COVID-19 never truly leave our midst ever since it began in January of 2020. We know the havoc that the pandemic had created between 2020 and 2021-22. However, in 23-24, though we had spurts of cases around the world, in the US, in Europe, in India, other parts of the world, we haven't had any consistent large number of cases that have come up. Lately, in the past month or so, there has been a spike in the cases of COVID-19 seen in places like Hong Kong, Thailand, Singapore, China, and also we are seeing a rise again in COVID-19 in India. To give you a reference, the WHO reporting on the COVID-19 tracking board showed that there were 25 cases in the last 1 month, and if you look at the last 20 days, there have been another 250 cases. So that would seem like a 10 times increase, but it's still a small number. We also have to remember not everyone is getting tested. JN1 is a variant that belongs to the Omicron family. Omicron is the same family that we realize has a high immune evasiveness, which means people don't always, though they have been exposed to Omicron or COVID-19 before or have taken vaccines in the past, including boosters, still their immune system is not able to evade or fight off this virus, and hence they can get sick. We know that there are two variants, JN1 and KP2, both of which have come at the same time or similar times and have been around for at least a year and a half now. But lately those cases are rising again, and again we are seeing a summer rise. Though we have noted even during the COVID-19 pandemic that the cases of COVID-19 did not really go down during the summer months like flu would do, because flu would largely be present in the winter season and also in India in the monsoon season, where the spike in cases were seen. Interestingly, symptoms are also very similar to what a flu-like illness would be, with sore throat, fever that can be low grade or high grade. People can have runny nose, blocked nose. We are not seeing as much of loss of sense of taste and smell as we did in the original SARS-CoV-2 variants. And also this can lead to cough and sometimes difficulty breathing. However, the rate of hospitalization with the JN1 variant is not as high as we had also seen with Omicron and its other variants before, and nowhere close to what the Delta variant had done in the summer of 2021. So that is some respite. Interestingly, even the past vaccinations that people have received, including with the booster vaccines, does not seem to give adequate protection against the JN1 variant. If someone has had previous variants of Omicron also virus, they are not getting as well protected against this variant, and the longer that time goes by, and the longer a person has not been exposed to this, the chance that they will get a repeat infection becomes higher because the immunity wanes down. Now, recognizing all of this, the question comes up, do we have a vaccine? While we have variant, the mRNA vaccines are available for JN1 variant and also in other parts of the world to the KP2 variant. These are called monovalent vaccines for SARS-CoV-2 for these specific variants. These are not readily available in India or widely available in India, and hence we still have to rely on wearing our mask when we are in crowded places or when we are traveling by public transportation. It's also important to wash your hands before you eat or touch your face. It also becomes very important that wherever it's possible, if you can maintain some degree of physical distancing, it would be very helpful. And most important is us not forgetting that maintaining a healthy immune system by regular diet, which is healthy diet, good exercise, sunlight, fresh air, also maintaining a good sleep hygiene and sleep regimen, all can maintain our ability to ward off a potential JN1 infection, which would just behave like a common cold or a flu, because these viruses are also circulating amongst us at the same time. People who are having, for any reason, a compromised immune system, people who are above the age of 60 or 65, people who have diabetes, hypertension, who are suppressed immunity due to cancer, chemotherapy or radiation or any such other organ transplantation, all of these individuals can get very sick with a JN1 variant also, and so they and their family members need to take extra precaution in terms of protecting themselves and their loved ones during this what I would call a minor outbreak. Now remember, and I've said this in my previous videos and you all can watch them if you wish to, COVID-19 is never going to leave our midst. It's going to be with us just as influenza after the major outbreak in 1919, 1920 never left us, and every year surfaced and continues to surface. We will continue to see SARS-CoV-2 in different variations coming to us at different points of time, and so we really have to take good care of ourselves, look after ourselves, and also where appropriate, if someone is in the high risk group, taking vaccination when possible and where available is very, very important. So friends, hopefully this gives you a fair idea about the JN1 variant of SARS-CoV-2 that is in our midst right now. We have to keep our guards up, but we do not have to panic or get scared. And I really hope that all of you all stay safe. Till the next video, take care, stay safe. God bless us all.